On the phone with us, we have Amador County Health Officer Dr. Rita Kerr and former Health Officer Dr. Bob Hartmann. Good afternoon.
Hi, Jim.
How are you today?
Good.
So, Dr. Kerr, thank you for coming on. Dr. Bob, thank you for coming on. The first question I would have for you, Dr. Kerr, is, so how do we stand here in Amador County?
Well, we are continuing to see steady, slow but steady, number of new cases being reported several times a week at least. And we continue to, in the majority of those cases, people are able to give a history that they were notified of an exposure or had contact with someone either at a family gathering or at work, or they traveled to an area that COVID was circulating. But we have had a handful that really have no idea where they could have contracted the virus.
Okay.
So that is, more concerning. That is what we've been seeing in neighboring counties. That's the definition of community transmission. So we absolutely need to be aware of that and be taking, all those extra precautions to keep our distance from others, wear face coverings, only be out for necessary reasons, don't gather with others outside of your own household, wash your hands frequently, and stay home if you're sick. That's the most important thing so that you don't spread it to others.
Right. So how are the tests? We heard on the ABC News, top of the hour, there's a lack of tests available throughout the nation. Have we been hit with that here in Amador County?
We have been collecting tests at this point, but are experiencing a bottleneck in getting those test results processed. There are several points along the testing chain. The first one being having the personnel and all the protective gear in order to even collect tests. The next one having the swabs and the test tubes with the proper liquid inside in order to get that test swab from the patient and put it in the tube and transport it to the laboratory. And then when it gets to the laboratory needs a certain type of chemical to process the specimen, and that is in shortage at this point. You may have heard that Sacramento actually has temporarily closed down some of its community test collection sites because the labs don't have the kits to run them once they get to the lab. And then there are so many tests waiting to be run at the labs that the turnaround time to get results is out past a week at most labs now. The hospitals that are needing those test results immediately to make decisions about patient care real time are able to turn things around a little bit more quickly, but they have a limited amount of capacity to do that.
Gotcha. So we were on the air today talking with Supervisor Crew, was giving us a preview of the coming meeting on Tuesday, and we were talking about the number. And can you go over that, either Dr. Kerr or Dr. Hartmann, one of you? What's the number? How many cases per day or in a 14-day period? What's that magic number that we're looking for to where we need to scale things back and maybe begin to close things?
So there's actually a dashboard of several indicators, and the case rate is one of those numbers. Okay. For Amador County, because we have a population of about 38,500, it would be 38 new cases in a 14-day period. And as of Monday, when I looked at our real-time data, we had 21 new cases in 14 days. And then I looked at the state dashboard today because some of those from more than 2 weeks ago have now dropped off that 14-day rolling average, and they have us at, just a moment, I have it, 18 new cases over the past 14 days on the latest dashboard. Mm-hmm. So we remain within the range. We have not hit the threshold for accelerated state attention for that one. They're also watching our test rate, and our current test positivity rate for all tests collected is at 2.1%. We need to stay below 8% test positivity. We need to be collecting more than 1.5 tests per 1,000 residents per day, and latest dashboard we're at 1.6, so we have met that target. We are not, outside the threshold. We are also having to monitor our hospital capacity, both in the number of beds available and ICU beds and ventilators available, and we remain within the threshold for those. And that's one of the things I wanted to call in today about is relative to our hospital. We received confirmation this morning that the one hospitalized case in our hospital who was not a resident of Amador County, it's a resident of a neighboring county who was brought to our emergency room and admitted to the hospital, to the ICU, and was on a ventilator, that patient passed away this morning.
Okay. But does that go against our count, or is that of the county where they were from?
The death will be tallied in the county of their residence, not in our county.
Mm-hmm. Now, why were they brought here, Dr. Kerr?
Because that's where their family wanted to seek their care. It's very common for people to seek their primary care or their hospital care outside the jurisdiction where they live for any number of reasons.
Can you give us, was that an elderly patient? Was it a young patient?
It was a person in their 60s.
Okay. And how long had they been hospitalized for?
They'd been in our hospital for just shy of 2 weeks.
So do we have any more hospitalizations?
Not currently in our case count.
Okay.
And there's no other COVID cases in our local hospital currently.
Gotcha. I was talking with Supervisor Crew today, and I was sort of putting words in your mouth from what you've said before, is that we just all need to do our part and be smart. And businesses are doing everything they can to stay compliant, but don't go out of the county, or don't invite your friends from out of the county to come spend the weekend with you that you don't know where they've been or what they've been doing, and just be smart. Was it okay for me to do that?
In general, yes, you've got that message correct, Jim, and I will say that the majority of the businesses are doing everything they can. We do receive calls and complaints about some businesses that are not wanting to have their employees wear masks or their customers wear masks, and we do outbound calls and counseling and follow up with them. And our hope is that this will become more usual, that more people will realize the importance of preventing transmission to others by wearing a face covering, and also continue to respect the social distancing, respect the limits on size inside a business, and avoid those gatherings of people, especially mixing people from different households and different areas. Yeah. That is the high-risk behavior.
I was in a grocery store yesterday, and I would say I only saw maybe 2 people without masks, and it was in each instance it was a mother with 2 children, and none of them had masks on, but everybody else had masks on. Okay. And as opposed to maybe a week or so ago, it might have been 50-50. And
so
now
I think people are starting to get that message and take it to heart and change that aspect. It's a habit that has to be cultivated. So remember to take your mask with you when you're going out.
What about that thought, my kids are immune to it. Kids don't get it. Only old people get it.
In the last couple weeks, we've had 3 school-age children who have confirmed infection. So kids do get it.
Are you working with the Amador County School District on the reopening or what we're going to do in the fall? We've got Dr. Slavinsky is going to be here on Tuesday to talk, and I haven't really talked to her beforehand. But are you guys working to try to come up with some plan, or are they putting a plan together, or does the state have the say over them?
There's a lot of interested parties in that, and the way it works is my job is to monitor the epidemiology, the COVID activity in the county, determine our level of community transmission, and at this point we are falling in the mild to moderate category. or minimal to moderate category of community transmission. The school district's role is to take the guidelines, customize them for all the considerations that are here locally, the size of the classrooms, the number of kids per classroom, the teachers and their age distribution, the transportation logistics and everything else, and to write a plan, and then I will review that plan with them and collaborate with them wherever flexibility needs to be applied to make the plan work, and then that whole plan will be presented to the school board. I believe the date is July 20th.
Mm-hmm. July 20th, that's a Monday. Also, that's a day that a lot of high school sports teams, coaches, athletic directors are looking for, because the CIF is going to announce at that time whether there'll be a fall sports season or not.
I have heard that.
Yeah, and a lot of, like Calaveras, Amador, we only have one school district. Calaveras actually has, I believe it's 5 or 6 different school districts, even though some of them are small. But all the superintendents signed a letter that said, we will not move forward with any sports, no conditioning, anything, until we hear from not the CIF, but the California Department of Health and the Department of Education, because those would supersede the CIF. Mm-hmm. And I think that's an interesting tack to take. I believe Amador County's teams have been conditioning over the last few weeks.
They had been. There had been some early interpretation of the fitness guidance to apply it to outdoor team conditioning. Mm-hmm. And then there has been a reinterpretation of that, and that is one of the things that Dr. Slavensky and I are planning to discuss when we are able to have a phone conference again next week, because the state does seem to have changed their interpretation of that guidance to say that conditioning is not going to continue to be allowed.
Oh, gotcha. So let's look forward here. Look in the crystal ball. Will there be a vaccine before the end of the year? Will there be a vaccine after the year? Will the vaccine be like the flu vaccine that we take every year, that you kind of, you hope you got the right mix in it? Is this mutating? Because you hear different people say there's a different strain on the East Coast and the West Coast. There's a different strain in Europe than in America. Is that true?
I know of at least 2 circulating strains that have been identified. And so, yes, viruses can mutate. The vaccine development really depends on which part of the virus they target. And if they're targeting a portion that mutates, then yes, it would have to be changed from year to year, mm-hmm. like the flu vaccine. If they can manage to target a portion of the virus that does not mutate so easily, it may be more durable when it's available. But all these are in very, they're trying to accelerate the development, but it's a process of determining whether it's effective and safe before it can be manufactured enough to start immunizing the general public. Mm-hmm. Mm-hmm. And that takes time.
We're starting to hear now that maybe there might not be such a thing as herd immunity with this.
The durability of immunity, even after an infection, is being studied. We don't have an absolute answer yet how much herd immunity is going to be able to be sustained over time.
Mm-hmm. Meaning what to the layperson, Dr. Kerr?
That means that somebody who's been infected that develops antibodies probably cannot get reinfected as easily, but we don't know how long that immunity from the natural infection would last. And that's what it really takes to build herd immunity. What
could we compare that to? What disease or virus is out there right now that we could compare that to?
Probably the common cold, which many of them are caused by other strains of coronavirus.
Mm-hmm. Mm-hmm. Do you feel hopeful there will be a vaccine?
I am I'm going to continue to hold out hope that there will be a vaccine.
If there's
I'll see if Dr. Bob wants to comment on that as well.
I mean, give him but I mean, if there's not, is this quote unquote the new norm for the rest of our lives?
Jim, this is Dr. Bob Hartmann here, and thank you so much for having us on the radio. And first of all, from public health and from all of the medical personnel and the county, our condolences go out to the family and friends of the unfortunate person who passed away in local ICU this morning. It's just a reminder that we have to consider that the virus is everywhere, and we have to do those things that you and Supervisor Crew and Dr. Kerr have all talked about on the radio today. Protect yourself, protect others by masking, 6 foot physical distancing, washing hands, and pay particular attention to our vulnerable populations. To get to your vaccine question, yes, we are very hopeful that there will be an effective vaccine, and as Dr. Kerr pointed out, the viruses do mutate, but it depends on which portion of the virus they can develop a vaccine for first, and whether that portion will be one that does not mutate or mutates only a very little bit. So we're very hopeful that there will be a vaccine. Sooner the better, but I think it would be very optimistic to think that there would be a vaccine by the end of this year.
Right.
Also, is this going to go on? Will this be the norm the rest of our lives? At this point, we know so little about. I mean, we've learned a lot over the last 6 months about this virus, but we still know so little about it that we have, if you look at the statistics, somewhere around 1% of the people in the United States have been proven to have coronavirus by testing. We think that the testing probably significantly underestimates the percentage of people who've been positive. So at some point, we may have some effect of that herd immunity, but boy, we're so far from it. In certain childhood diseases, pediatric diseases, we talk about herd immunity at 90%, at 94%. So we try to get the immunizations up as far as we can, and hope that herd immunity will kick in. But we are a long way from herd immunity. And so, what do we have out there that we can do now? And it's wear your mask, get 6 feet apart, wash your hands, be as careful as we can, and know that the science of this is getting better.
Right.
There are, Dr. Kerr and I get emails all the time, and there are innumerable articles that come out every week from bona fide, peer-reviewed medical journals that are telling us more about this virus. So, hopefully we'll get in front of it at some point, but we're not there yet. We just need to protect ourselves and others as much as we can.
You hear people talk about you see people driving in the car and they're wearing their mask. Is that necessary?
There is one instance where that's necessary, Jim. This is Dr. Kerr.
Yeah.
If you're alone in your car, or if you're only with a member of your own household in the car, then I would say no. Mm-hmm. However, if you're sharing a car with others from outside your own household, it may be a good reason to wear a mask and keep the windows cracked open so that the air circulation is, keeping stale air circulating and going out of the vehicle. Mm-hmm. People who take public transportation or who drive others, like the rideshare or Uber, Lyft, that sort of thing, are supposed to be wearing a mask at all times in their vehicle.
I know the Amador transit drivers all wear theirs all the time, too. So, Dr. Bob, when you go running with your running group, do you wear masks? Or, if I'm out hiking with my wife or my friends, do we need to wear masks out in the open?
Jim, the response to that is pretty much the same as Dr. Kerr's response to wearing masks inside of a vehicle. Examples. The running group I go out with pretty regularly used to be pretty large. We'd have 6, 8, maybe even 10 people at a time, and it's shrunk. It is rare for us to go out with more than one or two other people. And then we do keep our distance. If we have to ride in the same vehicle, which we try not to, but if we do, we wear masks like Dr. Kerr said.
Sure.
Another example, there's a group of, we call it the Sutter Creek Old Man's Walking Club. And most Friday mornings we'll get together at 6 or 6:30 and walk through Sutter Creek for 2 or 3 miles and kind of catch up. And we keep our 6-foot distance, and those of us who are older wear masks all the time. Sometimes the younger ones we may keep more than 6 feet away. So if you're with your own household, you do not need to do that. If you are with someone who lives outside of your household, a mask in 6 feet is the prudent thing to do.
Dr. Kerr, when you go out to dinner and you go into the restaurant, what's the proper, because I hear different stories on this, what's the proper, let's call masking etiquette on this? So I walk into the restaurant with my mask on. Then once I sit down, can I take it off? Or once the food's served? How does that, what are you supposed to do?
I'm actually going to find the piece of paper that actually, so I can read it to you, Jim.
Okay.
Because, and this is straight out of the California. I'm going to read this. I have to find it.
It's okay. We're talking with Dr. Rita Kerr and Dr. Bob Hartmann today on KVGC.
Okay. So this reads, persons who are seated at a restaurant or other establishment that offers food or beverage service may have their mask off while they are eating or drinking, provided that they are able to maintain a distance of at least 6 feet away from persons who are not members of the same household or residence. So really the best is to keep the mask on unless you're actually eating or drinking. Mm-hmm. And I don't think you need to take a bite, put it back on, take it off, take another bite. But the whole point is that while you're waiting for that food to come to your table, it's best to keep the mask on.
Gotcha. I'm really surprised that, and I know all the bar owners are going to hate me, but I'm very surprised that bars are still allowed to be open throughout all of California. To me, that's the one place that I would think everybody's, inhibitions would be dropped after a couple of drinks and, kind of a free-for-all. And
that was the first category to be dialed back on the 1st of July, was the bars. And it still could come to that.
Yeah.
There have been a handful of counties that knew their numbers were trending the wrong direction and decided even before the state told them that they needed to or that they had to, decided to close bars. We have not done that yet here. Our numbers have not gone quite that direction. And at this point, the exposure histories that we've been getting have been more about family gatherings or travel to areas that are higher risk.
What about employees that just refuse to wear a mask? Is there such a thing as the doctor gave me a special dispensation? I don't have to wear a mask because? Those
employees are supposed to be reassigned to other duties that don't require them to interact with the public.
Gotcha. Because, we've all heard those stories that, Sally doesn't wear a mask because she has anxiety or has asthma or what have you. How are the face shields? Are the face shields are they as good as a mask?
They're not as good as, but they're better than no face covering.
Better than no face covering at all, right? Yeah. Well, Dr. Kerr, Dr. Hartmann, thanks for taking the time to visit with us today. I haven't had a chance to sit down with either you and Tom, Bob, or you, Dr. Kerr, for a while and talk about this. Is there anything else that either one of you would like to share today to our listeners?
Well, Jim, thank you for having us on. It's always very interesting to be on with you, and the more information that can be disseminated to the public, and certainly KVGC is the major purveyor of that information in Amador County, so we really appreciate that. Mr. Dixon and I, as a matter of fact, just this morning were talking about the fact that we are hoping to be on the radio with you again next week. Of course, Mr. Tom Dixon is the CEO of our hospital, and we've certainly enjoyed our 4 or 5 times that we've been on the radio during this coronavirus. we will hopefully return next week.
Good. Now, I want to tell you one thing. We had to go to the emergency room for a member of my family over the 4th of July little holiday here, and we had to go over like a 2 or 3 day period. And I'll tell you what, I cannot say enough about Sutter Amador Hospital. We've had everything. We haven't had a birth yet, but we've had deaths. We've had broken bones. We've had thorns in the head. We've had just everything that you can imagine at Sutter Amador Hospital, and we've always been treated and felt like we had number one care. So I saw Tom at Lowe's the other day, actually, and passed that along to him. So again, great care at Sutter Amador. So
they do an excellent job, and they have really stepped up to the plate, even more so during this time of coronavirus with their preparations. It has been an absolutely huge chore for them, and they've risen to the occasion.
Yep, really have.
And people who do need to go to the emergency room, like you and your family, you should feel safe. It's probably a very safe place right now because they really are paying attention to everything that should be done to protect patients, protect their staff, protect all their workers.
Luckily, my family member could walk to there, so we just pulled up to where they had the guard there and got out, and they walked on in. But then I did see there was an elderly lady that needed to get driven in, and they opened it up, and she drove through, and they dropped her off and came back out. It was done very well. It was very, 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 very well planned out. So, Dr. Kerr, anything else you'd like to add this afternoon?
As Dr. Bob said, thank you so much, Jim, for allowing us to come on and answer these questions, to remind everyone in our community to take this seriously and take precautions, and again, to allow us to express our most sincere condolences to the family, friends, and loved ones of the person who passed away this morning.
All right. Dr. Kerr, thank you very much. Dr. Hartmann, thank you, and hopefully we'll speak again soon, and when we do, it'll be about brighter things.
Yes.
How's that sound?
Thank you.
So, all right.
All right. Thank you so much.
All right, 1340, 96.5 KVGC. I want to thank Dr. Hartmann and Dr. Kerr for giving us a call today. MC, want to do a little weather in just a few minutes? Okay, we'll be back with the weather right after this.